Hi there. If you're a BLS clinician in Monroe Livingston, there's a good chance you've heard of, seen, or used the Handtevy app. It was rolled out in the summer of 2023, but initially, due to a limited number of licenses, access was limited primarily to ALS clinicians. We're excited to share that. Thanks to the work and commitment of the Monroe County Chiefs Association, we've expanded the number of available licenses, and the Handtevy app is now accessible to BLS clinicians as well. This video will walk you through why the Handtevy app matters, how it's improved medication safety, and how to download and use it in the field. Let's start with the why behind the implementation of Handtevy. Imagine you're dispatched to a call for an altered patient with respiratory distress. Are you more nervous if the patient is 32 years old or 2 years old? Most of you would say the 2-year-old, and with good reason. Why? There are a few key factors. We take care of children much less frequently. They make up about 10% of EMS call volume, and even less when it comes to critically ill patients. That lack of exposure increases stress. We can't rely on one-size-fits-all equipment. For pediatric patients, everything from airway equipment to medications requires adjustment based on size. At the ALS level, that means more complicated medication dosing. Research consistently shows that even experienced clinicians are prone to dosing errors under stress. The math is hard when the stakes are high. So in short, 1, we have less experience with sick children. 2, the tasks are more complex. Together, these factors increase the likelihood of error. This issue is so common that in 2020, the Pediatrics Committee of the National Association of EMS Physicians reviewed the literature and released best practice recommendations to reduce pediatric medication errors in the pre-hospital setting. Highlights included confirming the patient's weight at the time of care, using kilograms, not pounds, as the standard unit of weight, estimating weight using one of 3 methods. 1, ask the parent, but remember, they'll likely give you pounds. 2, use a length-based tape. 3, use an application that estimates weight by age. When using length-based tapes, it is essential to use them correctly. Lay the child down fully reclined and measure from head, red to the head, to heel, not while they're still in a car seat, which will give an inaccurate result. Another key recommendation: avoid doing medication calculations at the bedside. That's exactly why the Handtevy system was introduced. Since its rollout, Handtevy has significantly improved the accuracy of pediatric medication dosing in our region. We still have room to improve, which is why expanding access to BLS clinicians is so important. A shared platform supports a team-based approach to safe medication dosing and ensures that all clinicians can participate fully in care. EMS clinicians also need the chance to practice weight-based dosing and assessment, which you'll get through the educational case series that follows. Up next, we'll walk you through how to install the app on your device, followed by an introduction to its features and layout. And finally, this is a living system. We're always looking to make it better. If you spot any issues, have suggestions, or just want to share feedback, please reach out to us at handtevy@milrems.org. Thanks, everyone.
Okay, we're going to briefly cover the installation of the Handtevy application to your iOS and Android devices. So once you enter into your device, go ahead and then go into the application store and search for Handtevy and download the Handtevy mobile application. Once this is installed, go ahead and open up the app itself, and then you'll see this home screen. Go ahead and enter in your first name, last name, and then for agency, you can put Milrems in all caps. Skip over the employee ID section, and then enter in your email or your agency email. Go and click register. As far as the installation code, at the end of this video, you'll see the installation code. It is the same for the username and the password, and this associates this application installation with the Milrems formulary and concentrations. Once that is installed, you are now into the application itself. And this is the agency code for Melrose. So utilize this as the username and password.
This video is to give you an orientation to the Monroe Livingston installation of Handtevy. We're going to go through how do you select and create a new patient based on their age or their size on length-based tape. We're going to discuss how you can identify normal vital sign ranges using the application, how you use it to find the right size equipment, which is particularly important as part of an ALS assist, and last but certainly not least, how do you search for protocols within the application, because this is going to serve as the main protocol app for our region. In addition to that, we'll show you how you actually can pull up the medications associated with that protocol, that though many of those are not within the scope of practice of a BLS clinician, are really important for things like ALS assist and helping them pull up the protocol when needed and performing medication cross-checks to enhance medication safety. When you open up the application, you're going to have sort of two paths, red pill or blue pill. And if your patient is a pediatric patient, we're going to go through that first. You're going to simply click on pediatric. What you'll see here is a bunch of different patient ages along the left, and the color coding corresponds with the color coding on the Handtevy length-based tape, which should be used really in any critical patient. But if you're dosing based on patient age or you're going to a call for a pediatric patient, one of the things is it sort of helps you be prepared by pulling this out and having it at the ready. So for example, if I was going to a pediatric patient who is 2 years old with whatever chief complaint it might be, I can simply select that and that will pull out a bunch of information. It starts out on the medication page, but if you look along the bottom, it says medications, drips, equipment, electrical, vitals. If I want to check, for example, what is the normal range of vital signs for a patient who is 2 years old, I simply click on vitals, and this shows me the normal range of vitals that is part of the application. This also, I can click on equipment, and that will show me all the different equipment sizes for a pediatric patient, which is important, for example, if you need to place something like a nasopharyngeal airway, but particularly important if you're doing ALS assist for more advanced procedures. And then the last page, where we start, is medications. If I wanted to search for medications related to a particular protocol, this is how we always search for protocols. I can search for any protocol by clicking this protocols up in the upper right-hand corner. And let's say I wanted to search for a protocol for a child with asthma. I can simply pull that up and I click on that and I hit apply. And this will pull up all the medications really at any scope of practice associated with asthma, but there's a little PDF icon right here, and I can click on that, and that will actually take me directly to the pediatric asthma or wheezing protocol, which will let me see what is in scope of practice at each individual level. If I wanted to change the patient age, so I thought I was being dispatched to a 2-year-old, but it was actually, for example, I don't know, a 12-year-old, I simply hit change patient age, and then I can come back here and it will reapply everything from that perspective. This is not just for pediatric patients. I can come back here and hit all patients, and I can create a new patient that is an adult. And this allows me to have different size adults, which is important for medication dosing, particularly at the ALS level. If let's say I have a patient who is 5'11" tall, I'm going to go ahead and click 75 kilos ideal body weight. This will put up medications, including the different drips, the separate equipment sizes, electrical things in cardiac arrest, and electrical components for cardiac arrest. Once again, if I want to search for protocols, let's say I want to say cardiac arrest, general approach, I can hit apply. This will pull up all the medications available at the ALS level, and it will also pull me up directly to the protocol list. And this is just a PDF that I can scan through, but it takes me directly to where I need to be. One of the very useful things that is part of Handtevy is that there is a CPR assist. So if I was going to arrive and create a new patient, let's say that we are going to a 5-year-old with reported cardiac arrest, what I can do is I can hit start CPR. This will automatically default to the correct compression to ventilation ratio.
Ventilate. Ventilate.
And initiate a metronome. If I am recording a cardiac arrest,
ventilate. Ventilate.
When other things like epinephrine are given, I can click on that and hit given, and it will start initial timers for things like defibrillation or medication administration, which is a huge assist when we are trying to
ventilate.
Record what has occurred during a cardiac arrest, as well as encourage the use of a metronome for improved CPR quality. If I go back to patients, this also stays as a record for things that I have done. Currently, we don't have full integration with the EPCRs, so it's not going to add the procedures and medications. It's something that we're working on. But if I go ahead and hit submit, what it will show you is the different components of the things that, for example, were given. And that is a very useful record, especially when you're giving handoff in the hospital and you want to say what medication was given and when. Finally, the last thing I want to review is how to use this to contact the hospitals. To do this, you have to be within a patient encounter, so we're just going to select an adult patient. Along the bottom, as I said earlier, there's meds, drips, equipment, electrical. If you click on more, it has contacts, which I can go ahead and click. I can select the different hospitals, and then I can look to see the hospital that I plan to go to and click on that. And that will give me a link to the med control phone number. One of the other really useful features of this is that it has under the notes what are the services available in that hospital for capabilities, which is an important thing to check prior to bringing a patient there if you're unsure. This has been a very brief whirlwind orientation to the Handtevy app for Monroe Livingston. I'm going to say that unless you use this regularly, you're not going to be familiar with it when you need it. We encourage you to use it as your regular protocol application because of its searchability. We are very open to any feedback if you see errors or opportunities for improvement. There's a lot that is customizable about the way that we represent information. And really the goal is that it helps you take care of patients. So please practice with it. You're not going to hurt anything, and use it as much as you can for patients. Thank you.